you mentioned, I want to make sure I get one thing clear. You mentioned about reducing the chances of taxing people. So are you saying that Grenadians will not be required to pay additional taxes for medical services?
Well, clearly, that's a sensitive question in any country. No one likes paying taxes. And again, I think when you think about taxes, we want to do what's reasonable. And I really think that, at this point, it's not appropriate to put a tax on people for healthcare at this point, given where things are. And I think most people support that. But there are Grenadians that are willing to contribute. We hear this all the day long. Like they pay their car insurance, like they pay their other insurance products, they're willing to contribute something to the system. Now, there's a group of Grenadians that we've been spending a lot of time talking to, and that's the people 60 and above. Those people can't get health insurance, and they want. They can't buy it. And one of the things we promised them is that in NHI, we're going to make that possible so that they could buy certain types of benefits that they want for themselves. One of the things you do not want to do is to restrict people from what they want. If somebody wants something and we could get it to them, let's do it. And so I believe that, some people, when you think about things like overseas care, that's a complicated issue. We've been involved in that business for the last 10 years. Okay, and in some care you can't get here in Grenada. Well, we want to be able to help people access those care abroad. And so the idea of developing funds, a fund, we could be philanthropic. There are many ways to fund national health insurance. One of the ways that a number of nations have done is something called a health savings account, where people literally work with the banks and the credit union, and employers could do it, a friend or family could do it. For Christmas, people, instead of sending a TV, for your family member that's from abroad, they'll buy you or put dollars in a bank account so that when you need health care, you have dollars to pay for it. One of the things we've suggested to the government is in putting this together, let's give a tax incentive to employers who actually put aside dollars for health insurance. Those are things that we could put in legislation that could help promote the start of action where people are funding healthcare. I'll say this: if we have a mechanism of funding healthcare, people would invest in the healthcare system.